I'm Andrea Klein-Thomas, reporter with CBS New York here at the 5th International Vatican Conference. Joining me right now is Dr. David Feinberg. Thank you for being here.
Oh, my pleasure. Nice to be with you.
Yes, so happy to have you here. You know, it's so interesting with this conference that it has so many stakeholders here all together talking about the different ways we can tackle problems. Why is it important to have these partnerships when dealing with patient health and overall wellness?
Well, when we talk about health and wellness, there's so many layers to it. There's the individual layer, the kind of biology. There's the system of the family you're part of, the community, your kind of spiritual life, the system that you need to interact with when you get actually any kind of disease or illness. So having this holistic view to me is absolutely crucial if we're going to fundamentally make care better for everybody.
And how does personal technology fit into that? And how can patients are always going online? How can you help make sure that they find accurate information and it helps their overall outcomes?
Well, that's really the core of who we are at Google, is to make sure that we organize and make information accessible. And in our case, we want to organize and make sure that health information is accessible, that it's understandable, that it's specific to your region, that you can find care, that you don't get down a rabbit hole that makes you more confused instead of less confused. So we have lots of teams making sure, whether it's on YouTube or Maps or Google Search, that we're providing folks with authoritative information in a way that they can understand and to go even further in their healthcare journey. So not only is it discovering information, but what kind of action could you take to maybe see yourself, the level of severity that you're suffering from depression or COVID, et cetera. So we can take folks even further down a road to health and wellness.
And let's talk about AI. You said that it is fundamentally changing predictive medicine. Explain that, and how do you factor in, the very layers, so many layers that people are already coming in with, whether it be their race and ethnicity and where they live, things of that nature.
Yeah, so it's pretty clear that artificial intelligence can be an amazing tool to assist clinicians in caring for people. Particularly in computer vision is one area we see it very positive, where if our computer takes a look at a mammography, the chances that that person is told that they have cancer and it wasn't, or vice versa, that they don't have cancer and it actually is, we can improve. We can improve on human performance there. But in doing something like that, when you really dig into the study, you find that the computer not only makes some mistakes and the clinician makes mistakes, the best outcome is when they're combined, when the clinician is using it as a tool to improve their diagnostic ability. And we have to be really careful when we train the models on certain data sets and they're being used in different situations, that people are aware of that. Because as you mentioned, you can get into problems if you don't have if you're not clear about where this tool can be used and when the tool should say, you know what, this doesn't make sense for me in this particular situation. And those can be things around geography, it can be race, it can be a host of factors. So we're really, really focused on when we design products to make sure inclusion is built in from the beginning. And when there is any bias, that we call it out. So anyone using our tool knows, hey, it's great, but it has these shortcomings. So please be careful in these situations.
And COVID has shown us how important technology is to maintaining healthcare. So we really look forward to the new products Google will be creating and how it will help our overall wellness. So thank you, Dr. Feinberg, for being here.
Absolutely.